Me and asked me to come and speak to you from the perspective of the Department of Health and Human Services and NIEHS about EJ issues. Can I get a show of hands on how many people are here from HHS? A few. Okay, so, but we are here, and I'm going to try to give you a little bit of a view, and partly just give you some background on myself. I'm an occupational physician, and I worked for NIEHS for a while. It's one of the HHS components that looks at occupational health and workers. And from that perspective, and then following, went to work with EPA on environmental disasters out in Region NIEHS. And I've been looking at kind of this perspective in terms of environmental emergencies and environmental impacts on our communities kind of from the operational level for a long time, and seeing the disproportionate impact amongst our communities, whether it's minority, low income, small population, disadvantaged, tribal, etc., the amount of impact, not only in terms of the environmental exposures, but also in terms of the healthcare assets and access to relevant resources, continues to be an incredible problem and challenge. From the Department of Health and Human Services, EJ, which I'm relatively new to at this level of perspective, we too are striving, and I guess from 1995 when this became much more focused to try to do what EPA is doing, is to incorporate EJ concepts, environmental concepts, into what the department's striving to do as a matter of fact, and not just something that we have to continue to fight for. And that is a challenge. It is fortunate to see that the interagency work group is up and running once again, and that the agencies are crossing over together and looking for opportunities to collaborate and coordinate. So in terms of strategies, the fact that we're pushing forward and having these conversations, and the department is currently having EJ listening sessions around the country in its attempt to revitalize the strategic plans which help to put things on the map. So these types of plans and concepts and papers and things, while seem very distant to folks, are really important in terms of keeping things on the table and keeping the discussions moving forward. So how do we translate this to products? Well, within the Department of Health and Human Services, we have essentially a few agencies which really focus on environmental health issues. I mentioned NIEHS, which focuses on occupational health issues. We have the Centers for Disease Control, and the National Center within there is the National Center for Environmental Health, and the Agency for Toxic Substances and Disease Registry. And then for us at NIH, it's the National Institute of Environmental Health Sciences. We have a few programs and things that we've been trying to do through the years, and I've been really impressed by having my short term at NIH looking at Chip's efforts and his programs to try to push forward these issues and try to show successes for communities and support for coalitions and this type of strategy that EPA is also focusing on doing, especially in Superfund sites with my former history. The Partnerships for Communication program is one program that I guess was also done with EPA and NIEHS to support actual coalitions, and had a number of success stories through that program. One such success story in San Diego, where the Environmental Health Coalition worked together with the local academic community to try to make ordinances, and the Port Authority of San Diego and the city ordinances to take into account buildings and roadways and construction and facilities and their proximity to disadvantaged neighborhoods, and actually were successful in a number of these efforts. The Alaska Coalition Against Toxics has emphasized the training of community researchers to collect environmental samples. Another project developed a lay health advisor program to train women from farm worker community to teach other women in farm worker families about how to reduce exposure to agriculture and residential pesticides in the home. The program reached over 600 farm worker families and include children. The West Harlem Environmental Action that developed the Environmental Health Leadership Program. A number of successes that we need to basically remember, that we need to hang on to this and show that people are pushing back about these programs or about these efforts by the department or about these efforts from EPA can be successful, and we can push back and say, look, this does work. There are ways to make this work. There are reasons to keep this going. There are reasons to keep this pushing forward. One thing that NIEHS, that I've been amazed to look into, Now, it's this effort of community-based participatory research, and which is really the thrust of trying to include, when we put together research, how do we get communities involved in those research efforts and those paradigms. The Deepwater Horizon incident is one, and we're doing some large-scale worker studies, but we're also now just developed a consortium. The NIH across the institutes have put money together, pooled money together, to support the academic and local community organizations in the Gulf to come together and research questions that they're concerned about, not questions the government's focused on, but questions that those community organizations and those local academic institutions in the community are concerned about, whether it's mental health, children's effects, women's effects, multiple chemical effects. Those particular types of things need to be evaluated. And I guess my time running out, but just in conclusion too, there's a number of initiatives that are going on, and I keep looking across the department, there's all these papers and things and topics, and I think there are opportunities within these initiatives kind of reach across. There's health disparities, sustainability, healthy homes, climate justice, and to find strength in numbers across these initiatives I think will be important for us and important for the future of the movement, to find the common threads, it seems, across these various discussions, which have so many overlaps and increase the strength in numbers about people's concerns about environmental issues, whether it's a local community or across broader examples and impacts across this nation and globally. And I guess in conclusion, thank you very much for having us, and best wishes from our director, Linda Birnbaum.